Hello, everyone, and good afternoon. Welcome to the Wellbriety Breast Cancer Awareness Month webinar. My name is Juliana. I'm the project coordinator for White Bison. So I'll be providing technical support during this webinar and kind of fielding questions and working with these wonderful ladies. If you have questions during the presentation, please type them into the chat on the side there. We'll be responding to some questions in the chat box at the end of the presentation. And then we will be recording the session to make it available to anyone who wasn't able to make it here live with us today. And we'll be posting it a couple different places, including Facebook and our YouTube channel. For anyone that may not be familiar, White Bison is a Native American Alaska Native nonprofit organization located in Colorado Springs, Colorado. We provide culturally based programs, trainings, and resources that are geared towards recovery and prevention of alcoholism and substance use disorders. We have programs for adult treatment, youth prevention, whole family wellness, healthy fatherhood, healthy motherhood, programs that address healing from grief and trauma, and programs that focus on reentry back into the community from incarceration or treatment. If you'd like to learn more about our programs, please visit www.whitebison.org, and the link will be posted in the chat box as well. Our special guests today are Miss Christina Campoy and Dr. Claire Corey. Dr. Corey is a licensed psychologist who has worked for the Pascayaki tribe of Arizona for about 28 years. At the age of 52, she was diagnosed with stage 3 inflammatory breast cancer. The cancer spread, and she is currently in treatment for stage 4 metastatic breast cancer. She's very concerned about how health disparities often negatively impact healthcare and treatment outcomes for Indigenous women. And then Miss Christina Campoy lives in the community of Guadalupe, Arizona, and is also a member of the Pascayaki tribe. She received a bachelor's degree from Arizona State University and is married with 3 teenagers and currently works at the Arizona State Legislature. Please note, Dr. Corey and Ms. Campoy are participating in this webinar as cancer patients, not as medical professionals. They cannot offer medical advice. They're here to speak from their experience as breast cancer survivors. Please make sure and follow up with your medical provider if you have any concerns about your breast health. So, ladies, kind of to start us off, can you tell us about any symptoms that you noticed and how you got diagnosed?
Sure. Just to put it out there, I was diagnosed with HER2 triple positive breast cancer. And the way mine started out was a dull ache on my right breast. It was towards the bottom. And it just, at first it was just a dull ache. And then as time progressed, it just became sensitive to touch. Claire?
Sorry, I got stuck there for a minute. Good afternoon, everybody, and thank you to everybody who's joined us. And I know Christina and I feel very strongly about this topic as survivors, and our hope is that any information that we can provide for our experience would also help others as well who may find themselves dealing with concerns about breast health or, possible cancer as well. And so I was 52 years old when I was first diagnosed with a rare and aggressive form of breast cancer. And so while most people may not need to worry about it, if you do have symptoms, it's really important to follow up on those immediately. And I know that it can be difficult to get good care or care in a reasonable period of time, especially if you're living in a rural area. But some of the symptoms that I had were one breast that felt heavier than the other. And at the time, I didn't realize that that was an issue to be concerned about. I was 52. I figured I was probably going into menopause. But one of the things I learned very quickly is that if you have a change in one breast and the other breast does not have that same change, that is something to be concerned about and something that you need to follow up with your medical provider about. And so I wrote it off as probably menopause. I also had a lot of itching. And then I had a mammogram and an ultrasound on May 3rd of 2017, and everything was said to be fine and that I should follow up in 6 months. But the breast was red, it was swollen, it felt hot to the touch, almost like it had a fever. And I had what they call the orange peel dimpling on the breast, which is a difficult it's a difficult symptom to have because that is a sign of cancer. And so my doctor did ask me to come back for another look and got me an MRI. And so 20 days after I was told that that my mammogram and ultrasound were fine, 20 days later, I was diagnosed with a stage 3B inflammatory breast cancer. It is important to note that inflammatory breast cancer often does not present as a lump. We're used to hearing breast cancers as starting as lumps, but that's not often the case for inflammatory, and that's why different types of screening are often needed for that particular diagnosis. Again, it's rare, unlikely to happen, but if anyone were to find themselves with those symptoms, it's very important to reach out immediately to your medical provider and make clear how important it is to quickly be assessed.
I can piggyback on um, how important it is to get tested and get tested early. When I got diagnosed, I was originally waiting for a colonoscopy. There's a lot of colon cancers in my family, so that was my main concern. That was my main priority, and I was kind of running late for my routine checkup. It was a 2 month wait line, two month waiting to get a colonoscopy. I was like, wow. In the meantime, my doctor said, well, you know what, you're due for your mammogram as well. And I had mentioned the achiness of my breast. So you need to get one, and you need to get one. And he had been calling me for about 2 months. 2023 was a very, very busy month for me, a year actually. My father had passed away in February, another family member in March. In May, my firstborn graduated from high school. And then come June is like, okay, now I got a little bit of time. I can get going on this. Um, so finally I did get scheduled for a breast exam or a mammogram, but then I noticed that it was just a regular mammogram. I called and had to tell them that I needed a 3D mammogram because of my history of knowing that I have dense breast. And a regular mammogram will not uh, show everything that's needed for me. So I needed to do a 3D. When I rescheduled for that, again, a 2 month wait list, 2 month time to wait for that to come to pass. Um, a month went by, and I said, you know what, I'm gonna call and see if I can get on a wait list. First, if somebody cancels, just if I can go somewhere further out where they can get me. And the lady that helped me was looking for a no. There's no, I needed to wait the 2 months. Then she did some further research, said, oh, wait, you know what? There's a coding error. I can get you in tomorrow. And I said, great, get me in. So I went. I had to go a little bit further, but I was able to go. When I done, the lady that walked me out, she says, you got this. I'm like, I've never had anybody say anything to me. You got this. Okay, you got this. Everything will be okay. You got this, or you got this. There's something there. And I had my mammogram. What was that? I had my mammogram on a Friday. By Wednesday, I had a biopsy. By that Friday, I was confirmed with cancer. The following Wednesday, I met my surgeon, and I had to decide. I was given a couple of options. I could do a lumpectomy, I could do the whole breast removal, or both, because I had the HER2 positive diagnosis. It means that this cancer is a fast growing. It's a genetic. So right then and there, I had to decide. I had my husband with me and my mom, and you just see this talking head, and you're a deer in headlights with all this information coming at you, and you have not done any research. I'm a type of person that I want to do my own research and know what's going on, what can happen, what I can ask, what I don't know, so I can ask. And I didn't have a chance to do that. I was right then and there. I had to decide because of the aggressive nature of my type of cancer. Um, I decided to do a bilateral mastectomy. So I made the decision to do both breasts, take both breasts. Um, my surgery was 2 weeks later from when I saw my surgeon. I had a surgeon, a microsurgeon, an oncologist, and then I'm meeting a cardiologist. It's just so many things thrown at you at once that you really, really need somebody that can be there with you to help you listen. And and whatever you don't understand, maybe they understood, and from there you can piece it together. If not, if you're not, able to ask your doctor, or you have an afterthought. Um, Mine fortunately was caught early. Um, I think the ladies from Senate Spirit maybe did these beads that show the size of um, cancer that can be found in. Mine was this little bead, which is the size of your pinky, and so mine was caught early. But whether I had to wait to the other month to get this test done, who knows if it would have reached one of the lymph nodes or not. So that's why we say that, it's a matter of urgency. You can't put off, even though speaking from my own experience, life does happen, but you have to take care of your health and put it in the forefront of all these other things that are happening in life.
Thank you so much for sharing like a little bit about what that process looked like for you. And you kind of mentioned how critical it was to get in there early, and that you experienced some challenges along the way. So what does it mean to you to self-advocate, and why do you think it's so important?
It's it's the most important thing that you can do. Um, Sometimes you can go in and, maybe, like I said, maybe you know what to ask. But it's important to once you're in the process and you're speaking to your doctor, and there, there's a lot of different things that can go on with self-advocacy. Some of the things may be, for instance, well, with reference to time is, distance. You know, distance. Depending on how far you live, I'm sure that there's a lot of people that don't realize that, for example, the Navajo Nation is one of the largest nations, tribal nations, that we have, and more than half of them, I would say, don't have running water. They live so far out there that they're infrastructure to cover such a vast amount of land. So distance, if you don't have water, then where's the nearest hospital? I can recall when I was younger, I used to go to the Phoenix Indian Medical Hospital right here on 16th Street and Indian School. And when I was little, I remember seeing a lot of people with trucks, and in their trucks they had their blankets and their pillows, and I'm like, why are people coming over here with all that? I didn't realize that they were coming all the way from Flagstaff, from up north, just to come and be seen, and that was a real issue. Nowadays, people say, natives get, they get everything free. They don't have to pay taxes. They get free medical. Well, that's not really true. I work. I still have to pay my taxes. And the hospitals, that not everything that's free is good. I'm sure that a lot of hospitals don't have all the resources that they need to help our indigenous population. Um, and for the patient, it's their distance, it's transportation. Do they have the means to get there? It's going to take gas, it's going to take money, some other people's time if you don't have a vehicle. Um, language and terminology. Not, I'm not a doctor. I don't know all these medical terms, but that's how they speak to you because it's their language, and they may, the doctor's language, and they may not realize or understand that, hey, I need to put this in layman's terms, to where, the patient can understand. Um, and sometimes being native, you're an indigenous person, we may be reluctant to ask questions. Maybe I shouldn't ask this, or maybe I can't ask this. And it's a matter of respect, but you need to speak up and ask about your health. What can I expect? What do I need to look out for? What do I need to do next? And just to be heard. Sometimes, there may, in some situations, in some areas, there may be a lack of patience for the patient, for the patient. And you, it's and you have to know that you matter, and that you matter, and that you can ask questions and ask for a second opinion. Don't be afraid to ask for a second opinion, or don't be afraid to ask, can you say that to me again? Or I'm trying to understand, and not be embarrassed to ask questions.
Dr. Corey, is there anything you'd like to add?
Yeah, I think Christina does a great job at describing many of the challenges. And I will say, obviously, both Christina and I live in an urban area. We do have access to more resources and more medical care by virtue of living in one of the nation's largest cities, here in Phoenix. And, I grew up in Montana, and so I'm from a rural area, and I know that it can be very difficult to access treatment, in more of the rural outlying areas. But even given that we're in a large urban area, I have found myself that it is really difficult to navigate all of the systems involved in treatment. There's a lot of phone calls that need to be made. There's a lot of confusion. Different doctors may not be communicating with each other, or um, maybe reports haven't gone to where they needed to be in a timely fashion. And I have found that it takes a lot of work to navigate all the different systems involved in your care. Like maybe who is doing a scan, and who's leading your oncology team. And Christina mentioned a cardiologist, and who is coordinating all of these appointments, and are they talking to one another? I found that it's really, really hard to navigate that. And what I also know from where I work is that in attempting to navigate those systems, people often encounter delays in care. And so maybe a scan or an MRI that they need is pushed out for a month or 6 weeks. And it's really important that as part of the advocacy, to speak up and say, no, we cannot wait that long. This needs to move quickly. And that's hard for any of us to do. And I know it's been hard for me, but like Christina just said, you matter, your health matters. It's important to speak up and find out. And like Christina also found, like she called to see if she could get in sooner. And don't accept delays. Do your best to try to get somebody to hear you. And I know that that's easier said than done, but navigating the systems is tough. Don't feel alone. You're not alone in that, because we're trying to navigate it as well.
Thank you so much, both of you, for, kind of explaining that a little bit. I wanted to go back just a little bit because especially it seems like for some people there are some potential markers that might make them more susceptible, and it might be a little bit more critical even to get in there. So you mentioned the term pre-vivor when we were talking before. Could you explain a little bit about what that means?
Um, I'm looking to see whether Christina and I are taking that one. So pre-vivor is a pretty new term that is being utilized, and that means basically a pre-survivor. And that may be a person who because of somebody else in their family who took a genetic test is aware that they may be at risk for a genetic or hereditary cancer, or maybe that person themselves has taken a genetic test and has found out that they have one of the mutations that can increase their risk for breast cancer and or other cancers. The common mutations that we hear about are the BRCA gene, BRCA1 and BRCA2, and the CHEK2 gene. And so those individuals who have genetic cancers in their family or who have tested positive, it's important to note, as one of my friends who's BRCA positive told me when her daughter tested positive, her daughter thought she automatically had cancer, but that's not the case. Her daughter does not have cancer, but she is at substantially increased risk for developing breast cancer in her lifetime. And so people who have tested positive on a genetic test or who have immediate family members who have may want to consider being tested, and also talking with their medical provider and other, possibly an oncology provider to find out what may be the best course of action for them to help. Some people will do a prophylactic mastectomy in order to substantially decrease the risk of getting cancer. So Previvor is an important part of the entire cancer terminology now because more is becoming known about hereditary or genetic cancers.
I'd like to mention that before I was diagnosed with breast cancer, I had done a genetics test because of the high instances of cancer in my family. Um, I took a genetics test, and I came back with positive for breast cancer and colon cancer. Um, and 6, 7 months later, that's when I was diagnosed with breast cancer. I mentioned that I was waiting for a colonoscopy. I did do a colonoscopy, and I was found to have positive cancer cells. Wasn't full on cancer, but they took care of what they needed to. Because of that, I did take one of my daughters to go get tested genetics testing, and unfortunately she came back with the same positive markers as myself. I'm getting my other daughter tested today, in fact. And what I found most difficult was for my son, trying to get him tested for genetics testing. My daughters, I went through a women's clinic, and they had a contract with a genetics laboratory. For my son, it was more difficult. Even asking our insurance provider for a list of where I can take my son, they gave me a list, but when I called and I have verifying each one, I couldn't take them there. You either already had to be an established patient or have been diagnosed already. Um, Finally, I was able to get an appointment for him, and hopefully all goes well. But I spent many days trying to find somebody for my son, and I just hope that something can be done to streamline that process, especially for males, because males, as I don't know if it was mentioned before or not, but males can also get breast cancer.
Thank you again. Oh, I'm so sorry. Dr. Corey, did you have something to add?
Well, yeah, I think I just this past weekend we had the Making Strides Breast Cancer Walk here in Phoenix, and I know Christina was there as well. But I did meet up with a man who was diagnosed with breast cancer in 2023, I think he said to me. And he did say that the incidence among men is increasing. And so the American Cancer Society and others do recommend that men do a chest check, and that if they notice anything unusual or any unusual lumps or unusual appearance or discharge from a nipple, that they do need to follow up with a provider. As Christina, just mentioned, men can get breast cancer too, unfortunately, because men are not used to doing the self exams that women are. They're often diagnosed at later stages. and that often also leads to poorer outcomes. So remind the men in your lives as well that they need to be checking, do a chest check.
Yeah, absolutely. That's really interesting information. I think a lot of people aren't aware. So thank you so much for bringing that to light. One thing that both of you mentioned a little bit earlier was about breast density and that you had like high density tissue. Could you explain just a little bit more about what that means and like how you know if that's something that you have?
Yeah, absolutely. So I consider this a very, very important issue. And every woman needs to know her breast density. And so just to back up a little bit, there are many, many different types of breast cancer. There's not just one type. And so it can be complicated. And so when you hear us talk about treatment and things, it can be different person to person. Um, but one of the things that again, as you mentioned when you were reading a little bit about me, is one of the things that I'm very concerned about are health disparities, and that Indigenous women have higher rates of mortality from breast cancer. In general, across the United States, deaths from breast cancer are decreasing, but among Indigenous women, those rates remain unchanged. And there's probably a lot of reasons for that. We're talking about access to care and advocacy and quality of treatment and different things. But one of the issues is that Native women tend to get mammograms less often, or less, if at all, less than other ethnic groups, certainly less than white women. Again, there's maybe a lot of reasons for that. You can't get in, you can't get an appointment, there's no mammogram provider nearby. But one of the reasons a mammogram is so incredibly important is that that is the only way to find out your breast density. And so you can't tell breast density from doing a self-exam. You can't tell by having somebody else look at your breast and see if it looks particularly firm or something like that. That's not it. What it is that you can only find out from a mammogram. And why is breast density so important to know? There's two reasons. One, it makes imaging more difficult. So, and Christina mentioned that she had high density breast tissue, as did I. She knew that a standard mammogram was not going to be helpful. She needed to make sure that she had a 3D mammogram. And I was also getting 3D mammograms at the time that I was diagnosed as well. If you have high density breast tissue, you need to demand a 3D mammogram. Hopefully that technology is available where you live, because again, it is in most places now, but probably not everywhere. The second reason why it's so important to know about breast density is because it does actually increase your risk of breast cancer. So in my family, there are 6 girls. Of the 6 of us, at least 3 of us have high density breast tissue. My sisters, because of me, are now getting enhanced screening every 6 months because they're high density and because they have a sibling with advanced breast cancer. And so there are now 4 different categories of breast density. And so again, you need to get a mammogram to find out what your density is. Every state now has a law that a woman needs to be notified about her breast density once she has that mammogram, and they will send you a letter. So if you get a letter, make sure and read it. Make sure and keep it. That's really important information to have, because if you need to schedule a mammogram and you need to insist on a 3D mammogram, you need that letter to show that. Also, if you don't get a letter or you don't get a notification after you have a mammogram, follow up, make a call, ask the question, what is my breast density? I need to know. I cannot, emphasize how important it is that every woman has that information, and you have to get the mammogram in order to have that information. Once you have the mammogram, the law is that you must be notified. If you're not notified, please follow up. Very important. I don't know if Christina wants to add to that, but I was the highest density breast tissue myself.
I don't think I have anything to add because you did such a great job. But what I do want to say is that when I went back to my surgeon, actually my oncologist, she did mention that when they took both breasts, the I had my cancer was found in the top, and I wouldn't have been able to have feel it. So that's why it was so important for the 3D mammogram. But once the tissue was removed, they analyzed everything. They found three more um, cells that were already growing. And that was at the bottom of my breast tissue. And that's what was causing my the achiness because I didn't even feel anything on my upper part of my breast. So that's why it's important to go and get and get your mammograms. I can't stress how important that is.
Yeah, absolutely. And it really sounds like a lot of this really does come back to that self-advocacy and especially for Indigenous people who might have different accesses to, the resources that help them get this. Okay, so what can you tell us about your treatment and kind of what that process looked like and especially like what barriers Indigenous people might face as they're trying to get into treatment?
Mine was mine was scary. Once it got started, mine was a scary journey from the get-go. Um, like I said, I from the moment I got diagnosed, 2.5 weeks later, I was already in surgery. Again, I opted for the double mastectomy, and I was so nervous about that. Just what that was going to entail. The not just the scars, but the the effects of that. And I was so nervous that even the day before surgery, my surgeon called, to see how I was doing and to give me just how to prep for the evening. And I was still doubting whether to do the double lobectomy or just one. And I was just in knots about it. Am I making the right decision? Is this what's best for me? Am I going too far? Am I doing too much? But I finally asked my doctor, I said, and she was a woman. I said, you know what? If Can I ask you something? She says, yes. I said, if I were your sister or or any type of relative, would you recommend this procedure, the double mastectomy? And she said, yes. So, that gave me some comfort and some reassurance. After surgery, Um, I had scars along, underneath both my breasts. I had a big scar under my arm, which they took out some lymph nodes to test them out, which I didn't know was going to happen. I was like, what is it? And then I had two tubes out of both sides of my body um, um, for drainage, and which I was not expecting. I didn't know what to expect. I'm here, with all these stitches, all these bandages. Um, what surprised me was that I went into surgery in the morning and I was expected to go home in the afternoon after that major surgery. Um, for I my breathing, my oxygen level was low, so they kept me another night. But that was just a shock to me that I was expected to go home after all that and take care of myself. I was fortunate enough that my husband was able to stay home and help me. My son helped me out a lot. All my children helped me out. They gave me my medications. You're in a lot of pain, so it was important to keep ahead of the pain. So you have a schedule. If you're scheduled for every 6 hours for pain meds, take it every 6 hours. Even if you're okay and you don't feel anything, because once it comes, and you have to wait for that medication to cycle through your system. Um, I was, it was hard, having to take care of yourself and take care of your needs. When you go to the bathroom, you can't use your arms, you can't you know stretch out too far. um, it was an arduous time, a hard time, but with the help of like I said, my family, which I'm very fortunate that I was able to do that, have that support. I was able to get through that. I do have a friend that my best friend that passed away from breast cancer last December. She was a single parent, And that lady, man, had dealt with this by herself. Strongest lady ever.
Thank you so much, Christina, and I'm so sorry for your loss. Um, Dr. Corey, what was your treatment like?
So I will say about Christina's best friend, who I knew as well, she was a very, very strong woman and continues to inspire us today. I will say I have a picture of her behind me in the office, but my treatment was somewhat different from Christina's. Oh, there she is. Yeah, Lori, beautiful. Um, she's greatly missed by many people here. And so inflammatory breast cancer is unique. Some of the treatment is different. There's no early stage diagnosis for inflammatory because it's so aggressive. The earliest possible diagnosis is stage 3B, and that's at the time I was diagnosed stage 3B. Very fortunately, because it wouldn't have been long if my doctor had not called me back for that second look, that I would have been a stage 4 diagnosis at initial diagnosis, and that's called stage 4 de novo. But I was diagnosed at stage 3, and so I had to do chemo first. Both Christina and I did chemo, but I did chemotherapy because they have to shrink the tumor before doing surgery. And so I did infusion chemo. And I do want to say that sometimes I know people are reluctant to get screening. You know, what if I have cancer? And then what if, I have to do treatment that is very difficult, as Christina mentioned. Treatment has changed a lot. I'm not going to say it's easy because it's not, but it's much better than it used to be. My grandmother died of breast cancer in 1993, and her treatment journey was extremely difficult. Here I am a generation or two later, and again, not easy, but much more manageable than it ever was before. Cancer treatment has come a long way. And so there are a lot of ways in which chemo is made easier than it used to be. So, for instance, I never vomited while I was on chemo, except the one time I got food poisoning, which actually had nothing to do with the chemo, but was rather due to a bad salad. And so it is better than it used to be. And so I did do chemo. I was able to continue working all through. I had 16 rounds of chemo for that cancer. Unfortunately, I was diagnosed a second time in 2021 and had to do another 20 rounds of infusion chemo. Um, and then after that, I went to surgery, and the inflammatory breast cancer, again, somewhat unique, but I had a mastectomy, a radical mastectomy, and then I had radiation after that. And so, again, treatment is different depending on the biology of the cancer, depending on the type of the cancer, but many of us will do some combination of surgery, chemotherapy, and radiation. And surgery can be a lumpectomy, which in only a certain portion of the breast is removed, or a radical mastectomy in which the entire breast is removed. I had a lot of lymph nodes removed, and so I have, you can see bilateral lymphedema in both my hands and my arms as a result of having so many lymph nodes removed on both sides. So that was a little bit about my experience.
As Claire mentioned, I also had chemotherapy. I had 12 rounds of that plus Herceptin, and that one targeted my HER2, the genetic mutation in my cancer. So chemo was to wipe everything out, even the good cells. That's why our hair falls out. Even eyelashes, eyebrows, everything. Um, and the Herceptin, I had until recently. I just finished my last round of Herceptin 3 weeks ago. I'm waiting now for my breast reconstruction. Because mine was found early, I was a candidate for breast reconstruction. If you're if and as you know, we keep saying this, every case is different. No two are the same. No two sizes are the same. No two locations are the same. And so depending on your situation, you're eligible for different um, procedures. Um, but but the effects of chemo was a lot of fatigue. I, as Claire mentioned as well, I didn't feel very nauseous. I did get headaches, and I was extremely tired. Um, I'm just thankful that I was able to have the resources to be able to stay at home and recuperate. Because if I needed to be out there and working, I don't think I wouldn't have fared too good.
Yeah, it definitely sounds like there's a lot of challenges that are kind of associated with treatment, but obviously it's worth it, and we're glad you're both here. Um, so we've only got a few minutes to wrap up here, but I wanted to ask a little bit about like what has your life been like after diagnosis? And I guess really like what message do you want to give to people who might be experiencing the same or might be scared that this is a possibility for them?
I would say that don't be so scared to not go. I am. I have a relative that we know that they're having issues, but the fear of finding out preclude you from going and getting treatment. That's really, really important. Go. The sooner you go, the better your chances. The sooner you go, the better the treatments that the opportunities that are available to you. Um, and what was the question again?
Sorry, no, just a little bit of information about like what your life has been like after your diagnosis. And then, you kind of said like what your message is for others.
Well, one of the effects is chemo brain because you can be talking and all of a sudden you'll what was I talking about? But as I said, my journey was um, it it was hard. I still have another major surgery coming up for my breast reconstruction, and I'm really um, anxious about it. This surgery, my first surgery, my double mastectomy was 4 to 6 hours. This one will be 8 to 10, and I've never been under that long. So um, it's like I said, it's different for everybody. But go and get tested. Go and get tested. Do your self exams. Um, I and sooner the better. Younger and younger women are being diagnosed with breast cancer. Um, they just reduced the age to 40 to be able to have your mammogram. It used to be 45. But because of the higher rates of cancer being found in young and younger women, they reduced it to 40. So go in and do yourself exams. Get to know what lumps are normal and what aren't. Um, I tell people it's not about that you're not doing something shameful or embarrassing. This is about your health. I mean, we prod and we poke, and if we have an ingrown toenail or if we have a zit, we're always touching. Do the same with your breasts.
Yeah, that's great advice. And I have to agree with Christina. I know that sometimes people will put off going for a mammogram or scheduling their screening because they're worried that something might be found. And again, I know that there's also a lot of situations where people may not have access to that screening or they're put on a waiting list. But if you do have any concerns, please do whatever you can to get in as quickly as you can. And just for regular screening, don't put it off because like Christina said, if there is something found, your treatment options are far better if you find it early. And the treatment isn't as bad as it used to be. Again, not easy, but it's definitely manageable and doable. And you know, Christina also mentioned younger women. And so for people who are under age 40, who might have found that they have a concern about their breast and they're not able to get a mammogram, or somebody's not taking them seriously. Unfortunately, because I've been now in the cancer community for 7.5 years, I am aware of many women who are younger than 40 who've been diagnosed with breast cancer. And often they've had to fight very, very hard to get a mammogram or an ultrasound or an MRI. If you are in that category and you have a concern, don't give up. Keep fighting, get somebody to listen to you, because it is an increasing challenge for younger women these days. And I would say that that if you find yourself in a situation where you are diagnosed with cancer, there's a tremendous amount of support out there. And there are other organizations that can support people. I know that I think Juliana is going to put some resources in the link for in this webinar, but there's the American Indian Cancer Foundation, and they have a whole part of their site dedicated to breast cancer, and they do an Indigenous Pink campaign every year, which their specific day, I believe, is October 17th. But there are resources out there. You're not alone. Even if you feel alone, you're not alone. And there are other folks out there who've been going through it, and it is manageable. And I guess, as was said to Christina when she was walking out that day, you got this, you can do it. And we're here to be a support. And if people have any questions that we can answer, we're happy to do that as well.
Thank you so much, Dr. Corey. And I am actually working on getting those links thrown in there, but the chat is yelling at me because it's too many characters. So just have to do that in a couple of messages. Um, so that is a great segue. Does anybody have any questions that they'd like to ask these wonderful ladies? Anybody? No? All right. No worries. Yeah. So I guess kind of as we're wrapping up, um, how are you guys taking care of your bodies now that, you're kind of dealing with the cancer, um, and just making sure that, you're staying positive and keeping that hope alive?
Well, as for me, I just appreciate every day more and more. You, honestly, we take a lot of things for granted, and and I've learned not to do that. I also look at food differently now. I look at food as medicine. Part of the risk factors is obesity for cancer. Um, and partly because, and I didn't know this, is that cancer cells are fed through for estrogen, progesterone, and the HER2 is the gene mutation. So our ovaries basically contribute to make the hormone for those that have cancer, breast cancer. But food, I look at it differently now. I look at it as, how is this nourishing my body? How is it giving me energy? How is it? There are foods out there that are um, cancer fighting foods. They don't cure cancer, but they help uh, beat it back a little bit. And a lot of those are plant-based foods. Growing up a plant-based, what the heck is plant-based? It sounds so odd, but really it's just fruits and vegetables. Think plants. Broccoli is really good. Berries, strawberries, blueberries, raspberries. I mean, have a berry cocktail, and it's delicious, and it's healthy for you. I also stay away from red meats now. I working and with kids and coming home late. I was the drive-through queen. Hamburgers, nuggets, fries. everything that I no longer do anymore. I stay away from red meats, processed meats, bolognas, and bacon, which I love. So it's an adjustment. It's an adjustment, but it's it's worth it. It's so worth it, and you feel better. Your body just feels so much better, healthier, and just exercising. Um, People say exercise. I said I don't have time to lift weights or get a video. No, walk. Walking is one of the best forms of exercise, and it gets your body moving. It gets your heart going, and it just good all around.
Yeah, I think Christina pretty much covered it, but I will say that, like Christina, I found that every day is a blessing. I am in current treatment now, and and I will be for the rest of my life because that is the standard for metastatic breast cancer. And but I very much appreciate every day that I get to wake up and be here. And what I find is that life can be very hard, but life is also very beautiful. And a lot of the magic is just in the mundane moments every day. Getting to drive to work, have coffee at my desk, get to see my colleagues in the morning, spending time with family, um, petting the cat, being with your loved ones, that those are the things that really matter. And cancer just makes all of that more relevant. It reminds you that every day is a gift.
Thank you so much, both of you, for being here today, for sharing, a little bit about your story and a little bit about, how sharing things that can help others, kind of get through this, make sure that they're taking care of themselves, and just sharing your knowledge. It's really, really appreciated. Um, for the rest of you, thank you so much for being here with us today for the Wellbriety Breast Cancer Awareness Month webinar. I just have a few little spiels to give real quick. So if you'd like to learn more about Wellbriety itself, you can contact White Bison at 719-548-1000, or you can email us at info@whitebison.org. If you'd like to get some Wellbriety products, you can visit www.thewellbrietystore.org or call 866-518-5275. We have some really wonderful resources. We also have online Wellbriety meetings now on Tuesdays and Thursdays on intherooms.com, then a Monday night meeting on Zoom. And you can like us on Facebook, where we are constantly doing giveaways and have monthly promotions. That's how, one of the main vehicles that we use to advertise this awesome webinar. And then, like I said, this webinar was recorded, and so it will be available on Facebook and YouTube. Thank you again so much for both of you. And everybody have a wonderful day.